Do you struggle with frequent joint pains, especially in your lower back, hips, knees, feet, and/or your ankles? If so, you may have osteoarthritis, a degenerative joint disease caused by a breakdown of cartilage, leading to pain, stiffness, and reduced mobility. Osteoarthritis and obesity are two health conditions that are often coexisting and can have a significant impact on your overall well-being. Weight gain puts extra stress on your weight-bearing joints, especially your knees and hips. The excess weight can accelerate the wear and tear of joint cartilage, leading to development or progression of osteoarthritis. The more weight a person carries, the higher the risk of developing osteoarthritis in these joints. The additional weight also makes it harder to exercise and maintain a healthy diet. This in turn can lead to further weight gain and worsening of osteoarthritis symptoms, thus creating a vicious cycle. To make matters worse, obesity can also decrease the effectiveness of some of the medications used to treat osteoarthritis. In addition, surgeries like hip and knee replacement may carry higher risk or complications if your BMI is too high. Given the interplay between these two diseases, it is very important to manage both at the same time. By addressing obesity through weight loss, adapting an exercise routine, and managing pain, you can significantly improve your quality of life and better manage your osteoarthritis. Working with a medical provider is important so you have personalized guidance and treatment options. If you suffer from obesity, we can help. In fact, helping people lose weight and improving their health is our specialty. Please reach out to us for more information or get started at healthymeweightloss.com.